A private jet can land anywhere in the world, but it cannot outrun a failing heart. Senator Douglas Fenn had proven that last Tuesday, somewhere over the Atlantic, when his chest had seized up like a frozen engine and his aide had screamed at the pilot to divert to Halifax. He had survived that one. His cardiologist had called it a warning shot. Fenn had called it indigestion and flown to Montreal the following morning for a fundraising dinner he refused to cancel. That dinner was tonight, and it was being held in the private dining room of Altitude, the most exclusive restaurant in the city, perched on the 42nd floor of the Maison Laurent Hotel, with a view of the St. Lawrence that cost a fortune just to look at. The chef had 3 Michelin stars. The wine list was longer than most people's mortgages, and hovering just outside the carved walnut doors of the private room, her back straight and her heart hammering quietly against her ribs, was Maren Okafor. At 28, Maren had learned to make herself invisible. It was the primary skill of the job, to move like water through a room full of powerful people, to anticipate and disappear, to see everything and be seen by no one. She was good at it, exceptionally good. The head server, a fastidious man named Philippe, had told her when she was hired that she had the instincts of someone who had been in fine dining for 20 years. She hadn't corrected him. She hadn't mentioned the 3 years she had spent in the Faculty of Medicine at McGill before the phone call that had dismantled everything. Her younger sister, Phoebe, had been 12 when the tremors started. The neurologists in Ottawa had used words like juvenile onset and progressive and manageable, which was a careful way of saying permanent and expensive, and your life is going to look very different from here. Their mother worked the front desk at a dental clinic, and their father had been gone since Maren was 9. There was no one else, so Maren had packed 2 boxes from her residence room at McGill, taken the bus back to Ottawa, picked up shifts at a pub on Rideau Street, and told herself it was temporary. 6 years later, she was carrying a silver tray through the doors of a 42nd floor dining room in Montreal, and Phoebe was 21 and still trembling, and the waiting list for the specialist program at the Ottawa Neurology Institute was 14 months long, and the deposit to hold a spot was $80,000, temporary, Maren still told herself. Just a little longer. She pushed through the service door and entered the room. There were 8 guests arranged around the long table, but the room belonged to Senator Douglas Fenn. He occupied the head seat the way certain men occupy rooms, as though the furniture had been arranged specifically around his ego. He was 63, wide through the shoulders, with the kind from ruddy over 4 decades of being the most important person in every room he entered. He was laughing when Maren came in, a big, rolling laugh at something his aide had said, and the sound of it hit the walls like something being thrown. Across from him sat a woman Maren recognized immediately. Claire Beaumont-Lachance, the managing director of a Quebec infrastructure firm that was reportedly trying to finalize a federal contract worth 9 figures. The dinner wasn't social. It was a transaction. Maren had worked enough of these evenings to read the geometry of a room in seconds. Who was supplicating, who was performing, who was terrified beneath their tailored suit. She moved through the first course without incident. White gloves, timed pause, the rich ritual of invisibility. Fenn drank his burgundy like water and talked louder as the evening on. When the evening went on, his voice filling the corners of the room. His personal physician, a thin, carefully polished man named Dr. Beaumont, no relation to the director, sat at the far end of the table, looking slightly bored and slightly superior in equal measure. Maren had noticed him the moment she entered. She always noticed the doctors at these events. Old habit. It was during the second course that she saw it. She was reaching past Fenn's left shoulder to set down a plate when his hand moved to his lapel. Not deliberately. It was reflexive, the way a person reaches for something they can't name. His fingers pressed against his sternum, just for a second. And then he picked up his fork and said something about infrastructure timelines to Beaumont Lachance and laughed again. Maren straightened and stepped back. She kept watching. His color was fine. His voice was steady. But there was a tightness around his eyes that hadn't been there 15 minutes ago, and the way he was sitting had changed slightly, shifted forward, shoulders risen, just a fraction, as though he was trying unconsciously to make more room in his own chest. She had seen that posture before. Not in a restaurant, in her kitchen in Ottawa at 2 in the morning, with Phoebe sitting at the table saying, she was fine, and the left side of her face drooping in a way that meant she was absolutely not fine. Maren set her tray on the service credenza and watched Senator Douglas Fenn very carefully. He made it through most of the entree. He even made a toast, raising his glass to the Beaumont Lachance infrastructure deal and the future of Quebec, and a lot of other things that sounded important and hollow at the same time. His aide refilled his glass. Dr. Beaumont was discussing something with the guest to his left, turned half away from his employant, utterly unconcerned. Then Fenn set his glass down and didn't pick it up again. He sat very still for a moment, which was wrong because Fenn was never still. His hand went back to his chest, the same reflexive press, but harder this time, knuckles whitening slightly. His jaw worked. He looked at the table in front of him with the focused, distant expression of someone trying to talk themselves out of something their body had already decided. Maren was already moving. She crossed the room in what she hoped looked like a natural trajectory toward the credenza on the far side, but angled herself so she passed directly behind the senator's chair, close enough to see the thin film of sweat that had appeared on the back of his neck just below the hairline. Close enough to notice that his breathing had changed. Shallower, faster, the ribs not expanding the way they should. She stopped at his shoulder. "Senator Fenn," she said, keeping her voice low and completely level, "is there anything I can bring you? Some water, perhaps?" He started to wave her off. The gesture died halfway through. His face had gone the color of old putty. He started, and the word just stopped. His aide, a young man named Callum, looked up from his phone. "Sir?" Fenn's hand pressed hard against his sternum now. The fork clattered against his plate. His chair scraped back several inches. "Dr. Beaumont!" Maren said, and her voice was not a request. The physician's head snapped up. He was on his feet in an instant, moving around the table with practiced efficiency, and Maren felt a flicker of relief until she watched him reach into his jacket pocket and pull out a small pill case with fingers that were completely steady and completely certain. "Douglas, I need you to put this under your tongue," Beaumont said, crouching beside the senator's chair. "Nitroglycerine. You remember the protocol." Maren felt something cold settle in her chest. Fenn's color was wrong. Not the pallor of angina, the familiar pale fright of a narrowing artery demanding more blood. This was different. There was a grayish-blue tinge creeping into the skin around his lips, and his left arm was hanging in a way that looked less like pain and more like absence. He wasn't gripping his chest. He was pressing his sternum with his right hand while his left lay open and loose against his thigh, as though it belonged to someone else. "Dr. Beaumont," Maren said, "please step back," Beaumont said, in the voice of a man who did not look at SUSMA staff when he spoke to them. "His left arm isn't responding," Maren said. Beaumont paused for half a second. Then he said, "referred pain, perfectly consistent with his lips are cyanotic." That landed. Callum the aide was now standing, his phone abandoned, his face white at. Claire Beaumont Lachance had pushed her chair back from the table. One of the other guests had produced their own phone and was looking at it with the paralyzed indecision of someone who doesn't know whether calling 911 will make them look alarmist. Dr. Beaumont pressed the nitroglycerin tablet into Fenn's palm and guided it toward the senator's mouth. His hands were still perfectly steady. His face was professionally calm, and he was, Maren was now almost certain, about to make this significantly worse. She thought of the first-year pharmacology lecture she had attended 11 years ago at McGill, when a professor had spent 45 minutes on a single slide about vasodilator contraindications, and how nitroglycerin in the presence of a right ventricular infarction could cause a sudden, catastrophic drop in blood pressure, how the very drug meant to relieve pressure could strip the remaining perfusion from a heart already starved of blood on the wrong side. She thought of Phoebe. She thought of the $80,000. She moved. "Don't give him that," Maren said, and her hand closed around Beaumont's wrist. The room went absolutely silent. Dr. Beaumont turned and looked at her hand on his wrist. Then he looked at her face. His expression went through several distinct phases: surprise, contempt, and finally a cold, very deliberate fury. "Remove your hand," he said softly. "Right now." "His presentation isn't left ventricular," Maren said. "Look at the vein distension in his neck. Look at his arm. If this is right-side involvement and you give him a vasodilator, you're going to tank his blood pressure and you will kill him." There was a sound from somewhere at the table, a sharp intake of breath. "She's a server," someone said. "Call 911, Maren said to Callum, without looking away from Beaumont. "Right now, please." Callum called. "This is unconscionable," Beaumont said, his voice shaking now, with anger, Maren noted, not uncertainty. There was a difference. An uncertain man sounded like he was calculating. An angry man sounded exactly like this. "You have no idea what you're looking at. Right-sided heart attack presents with hypertension, jugular distension, and loss of motor response in the extremities," Maren said. She had let go of his wrist. She was crouching beside Fenn now, who was grey and sweating and watching her with the focused animal attention of someone who has run out of other options. "Nitrates are contraindicated. He needs IV fluids to maintain preload, and he needs a paramedic team in this room in the next 4 minutes." Beaumont stood up. "I am going to have you charged with assault and interference with a medical practitioner. You are a waitress." "I know," Maren said. "Sit him upright. Keep him still. Don't give him anything." She took Fenn's right hand in both of hers and held it. His grip was weak but present. "Keep breathing slowly," she said to him quietly. "The paramedics are coming. Just keep breathing." Fenn looked at her. His eyes were dark and frightened and very, very alert. "You're not just a waitress," he said. The words came out furred and effortful. "No," she agreed. "I'm not." The paramedics arrived in 6 minutes. They assessed, they confirmed. They used exactly the words Maren had used, and she watched Dr. Beaumont's face go through another set of phases as they worked, this time moving from fury through a particular, airless kind of stillness that looked like a man watching his own certainty collapse in real time. Fenn was taken out on a stretcher. His eyes found Maren once more as they wheeled him through the door. She nodded. The room slowly emptied, the guests collecting their phones and their coats and their shaken expressions, murmuring to each other in the careful, lowered tones of people who had just witnessed something they weren't sure how to classify. Claire Beaumont-Lachance paused at the door and looked at Maren for a long moment without saying anything. Then she left. Maren stood alone in the remains of the dinner, abandoned wine glasses, half-eaten entree, a senator's cloth napkin twisted on the floor. Philippe, the head server, appeared in the doorway. His face was doing something complicated. "Okafor," he said. "I know," she said. She was called into the manager's office the following morning. The restaurant's general manager was a woman named Suzanne Trepanier, impeccably dressed, with the kind of face that gave nothing away and a reputation for it. She sat behind her desk with her hands folded and a thin black folder open in front of her, and she looked at Maren the way a judge looks at evidence before deciding what to do with it. "You touched a guest," Suzanne said. "Yes. You countermanded the instructions of his personal physician. Yes. You caused a significant disruption to a private dining event." Maren said nothing. Suzanne looked at her for a moment. Then she looked down at the folder. "Senator Fenn's chief of staff called this morning. The hospital has confirmed a right ventricular myocardial infarction. They've also confirmed that the administration of nitroglycerin in that context would have induced severe hypotension." A brief pause. "Potentially fatal." Maren kept her expression neutral. "Be that as it may," Suzanne said, "the protocols at altitude exist for a reason. We do not touch guests. We do not intervene in personal medical situations. We step back." She closed the folder. "Senator Fenn's legal team has also been in contact. They have sent this." She slid the folder across the desk. Inside was a document 2 pages long and a bank draft clipped to the top page. The amount on the draft was $30,000. Maren read the first page of the document. Non-disclosure. Agreement not to speak to media. Agreement not to discuss the senator's medical history, his treatment, his attendance at altitude, or the events of the evening in any context whatsoever. Standard release language at the bottom. A line for her signature. She read it twice. $30,000 was more money than she made in a year at altitude. It was approximately 1 month of Phoebe's medication and care costs. It was not, by any calculation Maren could perform. She placed the folder back on the desk. "No," she said. Suzanne blinked. It was the first involuntary expression Maren had seen from her. "I'm sorry. I won't sign it." Maren stood, and the chair legs scraped quietly against the floor. Senator Fenn made a statement in the ambulance. Callum was present, and so were 2 paramedics. He said, and I'm told these were his exact words, "Tell her I owe her whatever she needs. I am going to need more than $30,000, and I'm going to need it for reasons I'm happy to explain directly to the senator." Suzanne stared at her. "He nearly died," Maren said. "I understand the protocols. I understand why they exist. But I also understand that his physician was about to administer a contraindicated drug, and that the senator would not have survived it, and I find myself in the position of needing to hold someone to their word." She picked up her bag. "Tell his office I'm available to speak whenever the senator is well enough." She walked out. She spent the next 4 days in her apartment on Rue Saint-Sotique, working her other shifts, calling the Ottawa Neurology Institute to confirm that Phoebe's file was still active, and not answering 2 calls from a number she didn't recognize that she suspected belonged to a lawyer. On the 5th day, a different number called. She answered it. "This is Senator Fenn," the voice said. It was rougher than she remembered, scraped thin by whatever the hospital had put him through, but the underlying weight of it was exactly the same. "I'm told you won't sign the NDA. That's correct." A pause. "I'm also told you asked to speak with me directly." "Yes." Another pause, longer. "My lawyer says you're a problem. Your lawyer," Maren said, "is protecting the wrong person." The silence that followed was a particular kind of silence, the kind that meant someone was thinking rather than stalling. "Come to the hospital tomorrow morning," Fenn said. 8 o'clock. "Ask for Dr. Pelletier on the 4th floor. I'll leave your name at the desk." The private room on the 4th floor of the Montreal Heart Institute looked like a hotel room that had been invaded by medical equipment. Fenn was sitting up in the bed, which surprised her. She had expected him to look diminished by the setting, the way powerful men often did when horizontal and attached to monitors. He didn't. He looked irritable, which was probably his natural state, and tired, and when she came in he watched her cross the room with an attention that reminded her of the way he had looked at her in the restaurant, like a man recalibrating. "Sit down," he said. She sat. "My lawyer tells me you have no legal standing to enforce a verbal statement made in an ambulance by a man in medical distress," Fenn said. "He's probably right." "He's definitely right," Maren said. Fenn looked at her. "Then why are you here?" "Because you said it," she said, "and because you don't strike me as someone who says things he doesn't mean, even in an ambulance. And because I need help that your $30,000 draft doesn't cover, and I thought the honest approach was to tell you that directly rather than leak the story to the Globe and let someone else do it for me." Something shifted in his face. It wasn't warmth exactly. It was closer to recognition. "What do you need?" he said. She told him about Phoebe. She told him the way she had learned to tell it. Factually, without apology, without the practiced catch in the voice that she had noticed some people used when they wanted sympathy, and that she had decided a long time ago she wouldn't use, because she needed something real, not something performed. She told him about the tremors, and the diagnosis, and McGill, and the deposit, and the 14-month waiting list that she had been trying to claw Phoebe to the front of for 2 years. Fenn listened. He didn't interrupt. He didn't do the thing that certain people did, where they started nodding too early, and you could see they were already thinking about their response, rather than hearing what you were saying. He just listened. When she was done, there was a silence. $80,000, he said. "For the deposit, the full cost of the program is considerably more." "How much more?" she told him. He looked at the window. The St. Lawrence was visible from here, grey and wide, under an October sky. "My chief of staff is going to tell me this is a liability," he said. "It probably is," Maren said. "I'm not trying to deceive you about that. You countermanded my physician in front of 8 witnesses and a dinner that was supposed to close a 9-figure contract. The contract is still possible," Maren said. "Claire Beaumont-Lachance's office called the hospital to ask about your prognosis. That's not the behavior of someone who's walked away." Fenn's eyes moved back to her. "How do you know that?" "Callum told me. He also told me that Dr. Beaumont has quietly requested a leave of absence pending a review of your treatment history over the past 18 months. She paused. "I think you should request that review yourself before he controls the terms of it." The silence that followed was longer than the others. When Fenn spoke, his voice had changed in a way that was difficult to define, but not softer, more precise. "Who are you?" he said, "actually." "Maren Okafor," she said. "I'm a server at altitude. I spent 3 years in medicine at McGill before my sister got sick and I couldn't afford to stay. I've kept up with the literature because it's the only thing I could still do for her from where I was standing." She met his eyes. "That's everything." Fenn was quiet for a long time. Then he picked up the phone on his bedside table and pressed a number. "Callum," he said. "I need you to contact the Ottawa Neurology Institute. Yes, today. Find out what it takes to expedite a case review and what a full sponsorship of treatment looks like financially. Get me a number by noon." A pause. "And get me Arthur on the line after that. Tell him I need a new contract drafted. Employment terms, not a settlement." He hung up and looked at her. "My senior policy advisor on health infrastructure retired in March," he said. "I have been unable to find someone with both the clinical literacy and the political patience to do the job adequately. The salary is $110,000 a year. The contract would include a research and travel budget." He held her gaze without wavering. "In addition, my personal foundation will cover the full cost of your sister's treatment at Ottawa Neurology, both disbursements beginning this week." Maren looked at him. She had prepared herself for a number of outcomes. She had not quite prepared herself for this one. "You'd be hiring me based on one dinner," she said. "I'd be hiring you," Fenn said, "based on the fact that you walked into a room full of people with more money and more credentials than you, and you were the only one in it who was right." She didn't say anything. "I spent 22 years in the Senate," he said, "watching people with the right degrees make the wrong calls and watching people with no standing whatsoever see exactly what needed to be done. I know which one I'd rather have beside me." He tilted his head slightly. "If you're interested." She thought about the apartment on Rue Saint-Zotique. She thought about Philippe's face in the doorway. She thought about Phoebe sitting at the kitchen table at 2 in the morning, saying she was fine. She was fine. She thought about McGill, about the boxes she had packed, and the bus she had taken, and the word temporary, which she had carried so long it had worn smooth as a riverstone. "Yes," Maren said, "I'm interested." 3 weeks later, Phoebe Okafor was admitted to the Ottawa Neurology Institute under the care of the specialist she had been waiting 14 months to see. The intake nurse handed her a clipboard and asked if she had any questions. Phoebe said no, she thought they had everything they needed. Then she looked at her sister standing in the doorway of the consultation room, still wearing her coat, her hands finally absolutely still at her sides. "You didn't have to do this," Phoebe said. Maren said, "I know." She had not been back to altitude. She had not needed to be. The black and white uniform was folded in a drawer in her apartment, and the new position started Monday. And the literature on federal neurology funding that she had been reading since she was 19 was finally going to be useful to someone besides herself. The Senate press office released a brief statement that Friday. Senator Douglas Fenn, it said, had made a full recovery and would be returning to his duties the following month. The statement noted, in its final paragraph, the appointment of a new senior policy advisor on health infrastructure. It did not mention a restaurant on the 42nd floor of the Maison Laurent, or a silver tray, or a hand closing around a doctor's wrist in the middle of a very expensive dinner. Some of the people who had been at that table knew. They had been quiet about it, in the careful way of people who had witnessed something they were still trying to understand. But the paramedic who had taken Fenn's vitals that night, a woman named Bridget, who had been doing the job for 16 years and had stopped being surprised by very little, had told her partner on the drive back, quietly, that the assessment from the server had been the most accurate pre-hospital evaluation she had encountered in 3 years of working Montreal's downtown core. Her partner had asked what the woman's name was. Brigitte had checked her notes. Okafor, she'd said. Maren Okafor. Neither of them forgot it.